The World Health Organization has declared the risk of Ebola virus high in Central Africa. However, the UN Health Agency said the risk remains low globally. This even as the latest surge in Ebola-linked cases has been declared an international health emergency. WHO added that the virus had likely been spreading for months.
Declaring the FIC, I immediately convened an emergency committee under the IHR, which met yesterday and agreed that the situation is a public health emergency of international concern, but is not a pandemic emergency. WHO assesses the risk of the epidemic as the high at the national and regional levels and low at the global level.
The outbreak of the highly contagious hemorrhagic fever was declared in Eastern Democratic Republic of Congo last Friday. Ebola has killed more than 15,000 people in Africa in the past half-century. The 17th Ebola outbreak to hit the DRC is already suspected of having caused 139 deaths from around 600 probable cases, and experts say the numbers are likely to rise further. The WHO has highlighted the complexity of detecting and responding to the current outbreak. It has been spreading in hard-to-reach areas of the DRC's conflict-torn Ituri province, complicating things further. The rare Bundibugyo strain behind the outbreak does not show up on tests for the more common Zaire strain of Ebola. And with no vaccines or specific treatment available for Bundibugyo, measures to curb its spread are limited. The WHO has said it is examining whether any candidate vaccines or treatments could be used to rein in the outbreak. WHO stressed that all contacts of Ebola cases should be monitored on a daily basis and should not travel nationally or internationally for 21 days after exposure. Washington said it is screening air passengers from outbreak-hit areas and temporarily suspending visa services. Although a State Department official said the DRC football team would be allowed to travel to the United States for the World Cup. However, the DR Congo national football team on Wednesday cancelled a planned pre-World Cup training camp at home after the country was hit by an Ebola outbreak. Meanwhile, Bahrain has announced a 30-day ban on visitors from the DRC, South Sudan and Uganda. For more on this, our correspondent Louisa Olani has sent us this report. Listen in.
Fear is growing over the latest Ebola outbreak in the Democratic Republic of Congo, even as the WHO says it could take up to 9 months to develop a vaccine for this strain. Goma has tightened health checks on its northern borders after confirming a case, while nearby Bukavu braces for possible spread. In Kinshasa, authorities have cancelled the national football team's World Cup training camp over safety concerns. This is the 17th Ebola outbreak in DRC since the virus was first identified in 1976. With over 130 confirmed dead, more countries are stepping up measures as the death toll is expected to rise. From Lagos, Nigeria, Louisa Olani, WION World is One.